The NEOTRIP study is a study that wants to test the potential benefit derived from addition of an immuno-oncology, in particular in this case atezolizumab, to chemotherapy in women with triple-negative early high-risk or locally advanced breast cancer. And this is done in the neoadjuvant setting for several reasons, but after surgery, patients also receive an anthracycline-containing regimen as adjuvant for 4 cycles. We found that the rate of pathological complete response, which is a measure of the efficacy of your regimen, was similar with or without atezolizumab in these 2 subgroups of women. And this with a chemotherapy consisting of carboplatin and in nab-paclitaxel given for 8 cycles before undergoing surgery. Adverse events were more or less the same with or without atezolizumab, with the exception of a higher rate of abnormalities of the liver transaminases associated with the administration of atezolizumab. This was short-lived and without sequelae and long-term effects, and usually did not affect the probability of administering cycles later on. Well, at this point in time, if there were the availability of the drugs, it would be an easy call, because pembrolizumab administration is associated with an improvement of pathological complete response in the study Keynote 522, while atezolizumab does not improve the rate of pathological complete response. But the 2 studies are very different, and the endpoint of the NEOTRIP is indeed event-free survival, not a pathological complete response. And it is selected as event-free survival for a reason. When we designed the trial, and also as of today, we have no idea of the value of pathological complete response in the case of immune modulation by this new series of drugs. Because the intervention of these drugs on the immune system may well be something that shows up on long term without affecting the immediate response. So it is trying to compare 2 different trials with different goals and with different chemotherapy backbone as they were designed. For NEOTRIP, it is still very, very early. And so the clinical impact will have to wait until we have mature data on the effects on event-free survival. It will not take much longer, because in our trial we selected a patient population that was represented by 50% of locally advanced breast cancer, and the other patients were all with very high risk type of disease. And unfortunately, we know that usually these patients have an event-free survival that drops rapidly after surgery. So we will see the results, I expect, in terms of a few years. Oh yes, we have already fully characterized the PD-L1 expression because it was an element of stratification in our trial. We are rushing in to test for the extent and type of lymphocytic tumor infiltration, and we have performed several collection of the tumor and the blood before, after 1 month, and at the end of chemotherapy before surgery. And we are performing a series of molecular analysis and immunohistological analysis to see if we can find a predictor associated with better or worse probability of response at this stage, or of event-free survival at a later stage.